Michelle, Joe Kitchen here from New Zealand with Pearl, a Lockley, which is a Greyhound Lab cross. We're doing our surface anatomy assignment number 9, palpation of the bony landmarks. We're going to start with placing our hands onto the scapula and following that laterally and then cranially and down onto our deltoid tuberosity of the humerus. That takes us back to the scapula again, and we're just flat hands feeling for that ridge, a bony ridge on the scapula. There it is, follow that down, that is the spine of the scapula, and if we keep going we'll get to a little knobble on the end of it called the acromion process. And as I move caudally to the dog, looking to put my hands over the ilium, over the pelvis, and finding our iliac crest and out to our wings of our ilium. Stay into there, bony landmark number 4. Okay, it's all right. Come stand up again. Up, up, up. So as we go down, distally down the femur, we are now finding that groove for the sciatic notch from our ischial tuberosity, sciatic nerve groove, and onto the greater trochanter of the femur, which is nice and deep, sitting in there. Good. We keep following down the femur to the lateral condyle. Go follow the quads down as well, make sure we're on the lateral condyle, and our first bony knobble is the patella. You can tell by flexing the knee that we are on the patella, bony landmark number 6. And if you can just see from the lateral view, looking for latissimus dorsi, starting from that humerus, greater trochanter, greater tuberosity in there, and under the axilla, under triceps, and coming all the way from that area there, taking up this segment, and it joins into the lumbar fascia, this being the right latissimus dorsi. And you can sit facing, sit down, that's it. We're looking for the biceps tendon, which is on the medial aspect of the elbow. Just picking up the elbow here, and we're looking for the most medial tissue, extending the elbow out, and we can feel for the biceps tendon. Up, up. Once again, back to the scapula, just using our flat hands to palpate the spine of the scapula, moving slightly cranially into a fossa or a dip, and we will be finding there the supraspinatus muscle. There. Nice. As you go backwards, still see posterior aspect, trying to locate the middle gluteal muscle, just double checking we're on those crests, wings, ischial tuberosity, and here we have a lovely meaty middle gluteal muscle. Further caudally to the posterior aspect of our femur, we can now find this lovely meaty biceps femoris muscle. And finally, trying to locate this cranial sartorius, which is on the anterior aspect of the femur, and if we just take her into hip extension, feel in here as we go in through to flexion, we'll find a very elegant cranial sartorius sitting deep, here it is, in here, being landmark number 12. Good girl. Thank you.